So going through the focal therapy procedure, depending on what it is there anything that patients should be prepared for? Is it like normal radiation? Are there other things that they won't or will have to do?
Yeah, it's very similar. If someone was going to have a type of focal radiation, for example, the treatment protocol that would be administered, I don't think the patient can tell the difference between a focal radiation and a standard radiation, except we strongly believe that the chances of becoming impotent over the next 2 years is going to be greatly reduced.
So when it comes to the follow-up, there's still a prostate there, they've radiated the tumor, whatever treatment that's been chosen for focal. What's the follow-up protocol? How many times do they need to get imaged a year? What's the PSA levels needing to be?
Yeah, excellent question, because patients that have had standard radiation, for example, if their PSA drops down to 0.5, 0.4 and stays there indefinitely, check PSAs, every 3 months for a couple of years, every 6 months for a couple of years, and annually thereafter, periodic rectal exams. That's it. It's pretty simple. Men that have had focal therapy, they still have half a prostate that could develop a new cancer. And so those men are going to have to monitor their situation more closely, just as I would monitor someone who's been on active surveillance. So typically an MRI once a year, in addition to those other PSA tests that I already described, would be very reasonable to make sure that some new cancer doesn't show up in the untreated prostate.
That's a really interesting point. I've heard that some patients are concerned about getting focal therapy because there is a prostate left and the word cancer is so scary. But I think it's also appropriate to emphasize that prostate cancer, especially in those lower grade types, is really like a chronic disease, and that we should pay attention to the quality of life and the side effects, since it is a longer survival time that these patients will be experiencing.
Very much the case, absolutely.
So you mentioned that, PSAs drop to 0.4 or 0.5 after radiation, but what do we expect after focal therapy?
It's important to realize that since half the gland is still there, or sometimes more than half the gland, that the PSA levels aren't going to drop as far. And this further validates the need to get some annual MRI scanning done, because the PSA may come down and maybe around 2. And there is a little bit more room for error when you don't have a really low PSA to reassure you that there's no cancer present. So men that have had focal therapy shouldn't get concerned if their PSA is running 2 or 3. Depends on how much prostate gland is left behind, but they need to cross-check with some sort of imaging to make sure there's nothing going on that would need attention.
Hey everyone, thank you so much for watching today. If you would go ahead and subscribe to our YouTube channel, that helps us promote our videos across the YouTube platform. And if you consider donating, that will also help us disseminate information to thousands of prostate cancer patients all around the world. The link is in the description below. If you need more information about prostate cancer, you can go ahead and visit our website, PCRI.org, and I hope you have a great week.